I remember this feeling. It was a really powerful feeling that I'm sharing something with my family that they wouldn't probably understand without me.
Welcome to the episode 2 of the Babel Bureau, where European language policy gets decoded, debated, and sometimes lost in translation. I'm Dr. Alicia Pfeiffer, your guide through the maze of multilingualism, from the winding corridors of Brussels to the talk of European towns. The Babel Bureau is co-founded by the European Union. The views expressed are those of the authors and do not necessarily reflect the views of the EU or the European Education and Culture Agency. In episode 2, Katerina Maadla will illuminate the secrets of translation. Katerina is a professional interpreter working in Estonian, Russian, and English. She interprets at conferences and in public services, at hospitals and in court. She is also a doctoral student at Tallin University, where she studies translation in healthcare. Do you want to find out why interpreters love their job? And will AI replace them? We've got answers for you. Welcome!
It all began very early in my childhood because actually I grew up in a monolingual family. We are Russian-speaking minority in Estonia, but my parents they do speak Estonian, but only on a very limited level. But my parents wanted me to be really multilingual, so I started learning Estonian from the age of 4, and started learning English also from my first years in the school. When I was a small child, one of my first memories that I had that is connected to language mediation is when there was a news broadcast in Estonian television, and I was interpreting this broadcast for my grandparents. And I was presented like this miracle child. I remember this feeling. It was a really powerful feeling that I'm sharing something with my family that they wouldn't probably understand without me. I just wanted to have a master degree and decided to enroll into this conference interpreting program. And to my surprise, I was accepted. And this was a life-changing moment for me because I understood that actually the curiosity that I have for the world and for the languages is really something that can be embodied in this profession of this language mediator, because you can learn so much. And of course, another factor is that I'm interpreting in the language of my community. So my working language is Russian. So I mostly work in this Russian-Estonian combination. There is also this feeling, I think, of the mission to integrate the Russian-speaking minority into the Estonian-speaking world, because Estonia is actually officially a monolingual country, and Estonian is the language of public service communication. So according to the Language Act, every citizen of Estonia has the right to receive service in Estonian, and foreign languages should not compromise Estonian language. And that's why for the minorities who speak different languages, it sometimes can be complicated to talk to the public authorities and to receive services in their first language, which is not Estonian. And if you are working as a public service interpreter for courts and for the police, you are the one who is actually assisting your community to get the services. And this is a huge motivation for me.
I noticed that you were referring to the profession by different names. You said, like interpreter, and then you used the term language mediator.
Sometimes interpreting and language mediation are synonymous, but of course not always, because for me, interpreting is an activity that is done by professionals. This is very important in this public service communication, because sometimes I feel that there is this hierarchical difference between different types of interpreters. So conference interpreting is considered something very important for international communication. So, for example, presidents need to talk to each other in the first language, and that's why conference interpreters, as high-level diplomatic interpreters, are present. But on the other hand, if we think about public service interpreting, then sometimes there is this misunderstanding that in this type of language mediation is somehow not requiring all of these professional abilities that are needed to mediate communication between presidents. Interpreting as a process should always be done by the people who adhere to professional ethics, who are proficient in the languages that they are mediating. And for me, if the patient is speaking to the doctor, we are interpreter. It is the same level of communication that when two presidents are speaking to each other, we're interpreting. So the requirement for interpreters should be the same. But unfortunately, I think in public service, and there is another term for this type of interpreting, it's called community interpreting. I was talking to my students just a while ago, and I was asking them, why do you think this term community is used there? And they immediately say that, oh, this is something that is not in the conference, so this is not happening in this elite diplomatic environment. This is just a conversation between regular people. It's not complicated. It's something not so important, probably. And this even can be done for free, which is also true sometimes. There is a difference of perception by wider public and professional interpreters. What are the demands for the quality of language mediation? And unfortunately, I think that especially in such countries as Estonia, which is officially monolingual, but in reality very multilingual, because we have a lot of people recently coming from abroad because the war of Ukraine, and also we have historically very big minority, so Russian-speaking minority, and also Finnish-speaking minority and Latvian-speaking minority. Its translation is seen sometimes as something that is endangering the Estonian language learning. So because translation, of course, we may see that translation is like a bridge, like the metaphor for translation that is very well known, that this is a bridge between two different cultures. But if Estonia as a nation state defines itself as one monolingual culture, the presence of this bridge of translation sometimes is overlooked. So we are somehow creating this myth that we don't need this bridge of translation, that we should all learn Estonian. That is true, of course, but in some cases, we still need to mediate the language for the people who are just not yet there. And community and public service interpreters are the ones who are doing that when they are mediating communication in healthcare, in police proceedings, in court proceedings, or in education, for example, as well.
Like how, I don't think that we're going to resolve this, but like how can we mediate this tension?
This is a very complicated question. We are just having our elections next week, and there is tension. These are local elections, but they are raising this question that are connected to identity and to foreign politics. And this is usually what's happening when the populists are trying to get attention, because on local level we should deal with local problems. But in Estonia, and it's my personal opinion, I think there is this problem with Estonian language, and I'm speaking as the person who graduated from the school with Russian and the first language was instruction. I didn't have Estonian friends until I started the university, and my family we never had Estonian friends, and we didn't really communicate. So two communities have been living separately for many years. I think that it's all started from the Soviet occupation, and it just kind of continued for all this period. Now we have changed the system, and since last year there are no schools with Russian the first language of instruction in Estonia, and this is a very good goal, to have these children study together and communicate together. However, unfortunately, this is bringing tensions, because the children who have been studying in Russian, they cannot study in Estonian next week, right? So it takes time for them to just understand what is going on. And unfortunately, I think this will lead to a higher number of dropouts. Many teachers are still in this language teaching method that is based on the idea that there is some kind of language interference coming from the first language. So, for example, if you're teaching English, you should only speak in English, and you should make your students for this particular time of the lesson forget the first language, so you're not explaining in another language. So this is a misconception. So this interference, of course, maybe should be tackled, but this is not the main problem. So it's possible to teach another language also with acceptance of the first language of the person, especially when we talk about Common European Framework for Language Learning that has been amended just recently. Now we have the fifth language skill there. So before we had this in language learning, this traditional skills of listening, reading, writing, and speaking. And now we have mediation as a fifth skill introduced. So that means that already on the European level, we have this acceptance of the first language. Me personally, I don't know anyone who doesn't speak Estonian who has been living here. So I don't see it as such a big problem. But with the newcomers, it's really complicated for them to learn Estonian, because Estonians, unfortunately, are immediately switching to English when they are communicating with the learners. So it's hard to practice Estonian because all of the Estonians want to practice English if you are a foreigner. And also it's hard for interpreters in this regard, because especially for this European Union level, because unfortunately our delegates who are coming to participate in the activities of the Commission, they also tend to use English, but they are not using Estonian, and that means that also for high-level conference interpreting, there is not so much work to do.
But I'm very glad that you've mentioned the Common European Framework for Languages, which, and this is my personal opinion, I think it has been like a very forward-thinking tool. And I mean, you can also see how it has developed.
Of course, in the framework, they're not talking about translation as a skill. They're talking about this mediation skill. And of course, we can argue whether language mediation can always be considered as translation. Only being proficient in two languages doesn't mean that you will be able to translate in a quality way. So translation and translation awareness is something that I'm dealing, for example, with in my research. So my goal is to inform multilinguals that translation needs a particular skill set. And also, if this skill of translation is recognized on a wider level, that means that there will also be an understanding of the value of this profession. And because translation is a profession that is based on trust, because otherwise you don't need this third person, and you will be trying to communicate without this third person if you don't trust the translator. And the trust towards the translator is built on the quality of translation. And in my particular case, when I research communication in healthcare settings, so doctor-patient communication, it is very important that if in the monolingual Estonia, where the doctor is not obliged to provide information in another language, because according to our language acts, only Estonian is the language of communication in public services, so other languages can be used if the parties consent to that. But there is no obligation. There is what I see also in my research, the doctors and the nurses, they do recognize translation as needed, but they don't have awareness of what is quality translation. And they don't have this awareness that just being proficient in foreign language means that you will be able to translate.
Okay. Yeah, you mentioned translation awareness.
Translation awareness is knowledge about the process of translation and the quality of translation and the implications of translation.
If we were to think about maybe 5 top skills that make a good translator, what would those be?
What makes a good translator is this ability to indicate why are these people communicating. So what is the goal of their communication? Translation and interpreting, you need very different skill set, because interpreting is something that is happening. The translation is in the moment of speaking, so there is almost no delay between the original message and the translation. So the interpreter should be able to make very quick decisions on what would be a proper and clear rendition in this particular case. Good interpreter should know how the representatives of this particular profession speak. Professional interpreters and translators, they know the strategies that should be used to overcome particular dilemmas. So what happens, for example, what I should do when I forget something, when I don't know the word, the term, because we're not machines. We have different, feelings, emotions under stress. So
yeah, you could have a bad day.
Yes, of course, you can have a bad day, and you just maybe at this particular moment you don't know how is fender bender in the language that you're working in. But if you are trained, that means that you are prepared for this issues. And of course, you are aware also of the ethical standards. You know that, for example, in court settings, you cannot advocate for the person, so you cannot really involve your own emotions and feelings. And what is the main ethical rule for an interpreter is that I'm not accepting the job that I'm not able to do. So this personal responsibility. So in short, of course, language knowledge, memory, general knowledge, and the specialist knowledge, and also ability to employ correct and useful strategies in difficult situations.
The job is definitely demanding and stressful, especially if, you make a mistake, you are there's going to be consequences.
When I introduce myself and I say, oh yes, I'm an interpreter, I receive this immediate feedback. Oh, you are the one who will disappear in 5 years, so there will be no interpreters because AI and machine translation will just take your job. How does it feel? So I'm asked these questions very often.
What do you answer?
Of course, I think that interpreters at the moment are at the crossroads, and definitely there will be no jobs for interpreters who are not able to adapt. But on the other hand, we should understand that we rely on AI tools, on machines. We are losing, as you said, this accountability. In court, you are sworn, but who will be held responsible in the case of AI use? We'll be using AI where it is possible. But we will use human interpreters and translators where it is necessary.
Can you see that some AI tools could be actually very useful for you?
At least for interpreting. These AI and machine translation tools are only complicating my task because human speech is really unpredictable. I think it is even easier to use machine translation to translate the judge who will be using this legal language phrases, but it will be very complicated to use machine translation to mediate the testimony of a witness who maybe just has this particular variety of talking about things. And I sometimes use just to test the speech to text during my interpreting jobs, but it's just not working. And if we learn to speak in the way machine understands, so we will be using this short, repetitive phrases to talk about things, then of course machine translation will work perfectly. But I think that, and I hope that it's not going to happen.
All right. So one way to ensure that, the profession doesn't disappear is to have more linguistic diversity.
Yes, exactly. I think that our skill is so unique and we're so adaptable. Well, we learn so fast.
Okay, great. So that's somewhat reassuring. I wanted to ask, how is interpreting, this public service interpreting, organized across the Atlantic? Is there anything that, we can export out of Europe, or anything that we can learn from the Americans?
I participated in a healthcare interpreters training program at University of Utah. In the US, there is this recognition of language and linguistic needs, and there is also the system of accountability for the medical errors. Unfortunately, in Estonia, it's very hard to make the doctor responsible for the medical error, and it has been also recognized on an official level that there are problems with that in Estonia. But in the US, the system is totally different, and that means that the doctor doesn't want to take responsibility for providing false information because of the language barrier, and the doctor is assisted by the insurance companies who are providing certified interpreters to mediate communication, for example, for a Hispanic patient and an English-speaking doctor. I think that, first of all, we should review our system of accountability for medical errors, and we should include this language barrier as one of the risks.
The European population is definitely getting more diverse. We have existing linguistic minorities, but considering the mobility inside Europe and then also from outside, there's new linguistic minorities coming in, and we need to prepare.
And especially, for example, in Estonia, we still have this 3 languages here. So actually, linguistic landscape has always been, or not always, but has within the last 30 years, it has been trilingual. So Estonian, English, and Russian were used as main lingua francas here. But it started changing recently. According to the last census, we have 170% rise in other ethnicities residing in Estonia if we compare it to pre-European Union accession times. So the linguistic diversity is growing, and that also means that now we have more demand for English as a lingua franca, because historically it has been Russian, and with Russian it can be said that because we have big Russian community, there's not so much need, there was not so much need for interpreting, because Russian-speaking patients were choosing Russian-speaking doctors from the same community. So there was no problem in finding the doctor who has, for example, Russian name and supposedly will speak Russian. However, it's not always the case. And in my research, I also have the evidence for that this ascribed identity through the name, it's not always true. But now with this English and other nationalities coming, of course, we have this higher demand for English as a language to share communication. Within my PhD studies, I research paraprofessional interpreting in Estonian healthcare, and I am in my research explaining what is happening in this healthcare mediation in Estonia. So who is translating, what languages are used, and what are the patients, non-Estonian speaking patients' views on the quality of language mediation and multilingual communication in Estonian healthcare. So I'm a qualitative researcher, but I also use survey data. And
what's the conclusion?
What is maybe the most important is that there is a need, as my informants, who are doctors, nurses, midwives, say, for translation. There is a difference between the views on who should translate. The doctors are mentioning that they would prefer professional interpreters to translate, for example, patient-doctor consultations. But the nurses, on the contrary, are suggesting that their colleagues should step in the role of translator. So there should be someone in the hospital from their profession who will mediate the communication. And this is what is happening right now in hospital settings. When there is a language barrier identified, the medical professionals are literally opening the door of their office and shouting in the corridor, "Is there someone who could translate for me?" Or the second case is that the person with this other language knowledge will just step in there, so will take the role of this doctor and will explain the patient what the initial doctor wanted to say, which is, in my view, very risky, because there is sometimes a mismatch between the professional knowledge. Because, for example, if the doctor wants to share something with the patient, it's not the doctor who is explaining this to the patient, but, for example, someone else, like a nurse, so stepping into this doctor's role, and the doctor maybe doesn't really understand what the nurse is suggesting the person, and so there's this problem of accountability of who is actually treating me, the doctor, the nurse. Hopefully it's not going to be the caretaker or the janitor or someone else in the hospital who will be just proficient in this language but won't have this medical proficiency. So there are this, on my view, very risky practices, and they are based on the lack of recognition of the need of professional interpreters in healthcare. What is also risky is that now many hospitals are suggesting the patients to bring their own interpreters if they think that they would encounter language barrier. But there is no explanation about who is an interpreter.
It could be just your friend,
a relative. So this need for this professional qualification, and it's so this is very ethically complicated issue, and I just hope that that the awareness about the risks that these practices lead to will be higher.
Okay, I think this works as a good summary, conclusion.
At the moment, I think very privileged to have these human translators and human interpreters among us, and let's recognize their work. Because I think that the period of invisibility paradigm of translation and interpreters, so this era is over. Because if we don't recognize professional interpreters and translators now, they will disappear for real.
Okay, wow, these are very powerful words, but yeah, we can definitely end here. Thank you very much for your time. I very much appreciate it, and I thank you as my guest and an interpreter for your work. This was the Babel Bureau, a podcast about language policy in Europe. Today's guest was Katerina Maadla, and we talked about interpreting services. I'm your host and producer, Alicia Pfeiffer from the University of Eastern Finland. Our music was made with Suno. The Babel Bureau is available to listen for free. This podcast is funded by the European Union under the PLURI project. PLURI is an initiative committed to fostering inclusive multilingual education for domestic and migrant linguistic minorities. For more information, visit our website at pluri-project.eu. And I'll see you in the next episode.